Happy Saturday, guys. This is Dr. Mary with the Remedy Room, and I wanted to do a quick little interview with obviously the most amazing doctor and mentor that we have, but someone who has a lot of experience with intravenous vitamin C, and it's very difficult. This past week has been hard to continue to see the results coming out of China from the doctors who I'm speaking to, who are using IV vitamin C, who are getting amazing results. When you hear a doctor say that 50 out of the 50 people he treated got well, to me it doesn't seem to make sense to use other drugs that have so many high side effects when we have something that's so inexpensive, that's safe, and that's effective. So right now I just want to do some question answer interview with my dad, Dr. Charles Mary. Hi, Dad.
Hey, Mignon. Good to be here.
So this is the world of Facebook where everybody's out there, and I want everyone to share this message. So tell us a little bit about your experience with high-dose IV vitamin C, and what can we do to start getting it in the hospital setting, and who you've saved with it.
Okay, as you know, I finished medical school in 1961, and I worked for the state of Louisiana Charity Hospital and the state health department until 1974. I went into private practice in 1974, and I was disappointed that not a lot had advanced in cancer and infection and whatnot. In other words, from 61 to 74, I thought things were pretty static in medicine. So I started reading and going to conferences, and I found a doctor in North Carolina named Fred Klenner that was making claims about curing all kinds of diseases. Everything from rattlesnake bite to lockjaw tetanus. He said he could fix it with high-dose intravenous vitamin C. So I got copies of all the lectures he had given, read all the journals he had written, and got audio tapes of his lectures. And he was even using vitamin C for cancer treatment. In any event, I called him on the telephone, and he said, as a doctor, this is too good to be true. You know, I have to doubt you because you're curing too many things. He said, well, if you don't believe me, do you ever see any young people with mononucleosis, with liver involvement, virus infection, infectious mono, kissing disease with swollen glands?
Yes.
Well, some kids get it when they're in college, and their liver gets involved, so they have hepatitis. They feel so bad they have to take a semester out of school. So anyway, he tells me, if you have that, be sure you give 60,000 milligrams of vitamin C intravenously and see for yourself.
So he said 60,000. That's 60 grams or 60,000 milligrams?
60,000 milligrams, correct. In any event, within a month, I had two patients. One was the son of a U.S. senator, and the other was the son of an attorney in town whose wife worked in our office. Both were Tulane students and had such bad infectious mononucleosis. Only thing they would sip was Coca-Cola and orange juice. Wouldn't eat any food at all, no appetite. So their liver chemistries were abnormal, so they had hepatitis from the mono as well.
Right.
So I gave them the 60,000, and within a day and a half, they wanted hamburgers and Big Macs. Get me a hamburger, get me some food. They were all feeling better. It took a week or so to get their chemistries normal, but I only kept them in the hospital about 4 days.
Well, and that was in the 80s. Like, you stayed home.
No, that's 1974.
1974. So you would stay home from school for a month if you had mono, 2 months.
Sometimes drop out the whole semester.
They have to miss this semester. So in a day, 2 days, they're eating burgers and back to
back to normal within a week.
Wow.
So in any event, I was impressed enough to use it in other cases. I had a physician, a surgeon from New Orleans, friend of yours. Anyway, he had a hepatitis from blood, serum hepatitis from patients and operating, getting blood on his hands or whatever. Anyway, he was jaundice, yellow jaundice. Gave him the vitamin C, cleaned him up in a couple, 10 days.
Wow.
So he's a convert. Everybody else wanted to know, what are you doing? I said, don't worry about it. So then I gradually increased for severe infections up, like septic shock, up to 100,000 milligrams. In fact, I even had a patient who had bad AIDS infection, and he had infection in the brain and infection in the lung. And all the consultant doctors said, send him to hospice, let him die. Nothing can be done. The antibiotics aren't working, let him die, let him die. So I just said, no, I'm going to increase the vitamin C. I had a very good pharmacist, Earl Watney, at St. Charles General Hospital. I said, Earl, we're going to have to keep going up till this guy gets better. So we went up to 400,000 per day, 24 hours, 400,000 milligrams.
Wow.
Within a week, guy was normal temperature, infections were clearing, he started to eat. He gained so much weight, the nurses had to give him a bath towel from the hospital to put in his pants because he couldn't button his pants. He got so much weight.
After he discharged.
Correct. Infectious disease doctor sent him back to work. He was a chef at one of the big hotels in downtown New Orleans.
Wow.
An infection guy said he's doing so well, he probably, if he doesn't do any bad activity, he can fine go back to work.
Wow.
Well, I wanted him to keep coming to get the IVs. Any event, when he got the word from the infection guy that he was well, he stopped treatment.
Okay.
So within a few months back, then he was gone. But in any event, we did cure that what were fatal lung and brain infections for a guy with no immunity from HIV.
Right.
In any event, I reviewed all the literature I could, talked to Linus Pauling, read the books from Dr. Stone about Irwin Stone, the healing factor, vitamin C, and found out that high-dose vitamin C detoxes the poison of gram-negative bacteria endotoxin, and that's the same poison that viruses use on us. In other words, gram-positive bacteria, as you know, make poisons, exotoxins, like snakes make poison.
Right.
So when you get strep infection, you get red around it and scarlet fever and those kind of things.
Right.
But other gram-negative infections, they don't put out any poison until the body attacks them, and then the poison is inside their cells.
Okay.
And then people get septic and sick from them.
Okay.
Same thing with virus. It's endotoxin of the virus. So anyway, the vitamin C can neutralize that endotoxin.
Yes.
So now the symptoms go away. And then that gives your body time to recuperate, and then the immune system can kill the virus.
Okay, so do you hear what he's saying? So it's not that, it's again, the body's actually healing itself. It's like the vitamin C gives you enough of a break to reduce the inflammation, stop the poison from causing so much inflammation in the cell, allow the lungs to exchange gas, and that's what would help these patients who have viral illness who are in the ICU right now. And so we are really doing our best, and this is why I'm filming this today, is like we have a message, we have an agent that nature has given us. We unfortunately do not make it in our cells, other animals do, and we need to get the word out to all of our community as well as the doctors to say, what else do we have to lose? So the side effect profile is basically none. In the years that can you talk about this fear of kidney stones, Dad, and the amount of vitamin C that you've given?
That's just foolishness.
Well, they've had studies to prove that the kidney stone, that's not true. That's a fallacy.
As you know, after my stroke and car accident, I had to stop practicing. Your brother Chuck took over. And he phoned up the vitamin C manufacturer people. And they told him at the time that I had given more vitamin C intravenously than any doctor in the United States, so probably in the Western world.
Right.
And I tell them, if vitamin C caused kidney stone, I'd have paved the road from here to Baton Rouge with the amount of giving.
Wow, we could have gotten rid of all the potholes. Okay, so let's just talk a little bit about what advice could you give to someone who has a sick family member about taking it orally? Remember, like I tell people, look, we still use the same powder that you started with at your office and that you gave to your patients. So orally and then intravenously.
What you need to know is vitamin C was discovered to prevent scurvy, which is bleeding gums and falling to heart attacks from sailors used to get it from being on the sea a long time getting no fresh fruit. So in any event, the amount that's recommended by the government, the scientists, to say take vitamin C is the amount to keep you from getting scurvy, 60 to 100 milligrams. So they think 500 milligrams is a big dose.
Right. Not
so. Animal studies show that animals that make vitamin C in their body, like horses, dogs, cats, they make, if they weigh as much as humans, more than 10,000 milligrams every day just to stay normal.
Right.
In times of stress, they make up to 40, 50,000 milligrams.
Okay, so
using an animal model, you need 10,000 to stay healthy. And I used to take that when I was in practice and never missed a day's work, never had a cold or a flu in more than 20 years.
And that's in divided doses. You wouldn't take it all at once.
If you take it all at once, it can give you loose bowels. So your body will tell you when you're saturated, it eliminates, goes out. But sick people can take huge amounts by mouth.
Right.
In any event, what I want to tell you is, I'm not telling you this is something I read in a book or just talked to Dr. Klenner. These are things I have done. And if God lets me stay alive until May of this year, I'll be a doctor 59 years, so I've had the opportunity to see a lot of things.
Well, and you have the experience, so this is...
Oh, yes, and I had a patient, who's a friend of mine, came to the office one day with a severe headache, had stiff neck, Kernigan-Brzezinski, so he had meningitis and encephalitis. So I sent him with a note to the emergency room in Jefferson Parish saying, man has meningioencephalitis, please do spinal tap and let me know what's good. So they kicked him out, said migraine headache, and threw him back in the street. So I told him to bring his girlfriend to bring him to the office. So every day I gave him 60 to 100,000 milligrams vitamin C every day. I did the blood test, the acute and immune times of your serum,
yes.
And he was positive for West Nile virus.
Yes.
Complete recovery with no side effects.
Correct, I remember.
He had no residual neurological problem from West Nile virus in the brain.
Right.
And as you know, the brain is selective about what gets in it. They have what they call blood-brain barrier. But the lungs need blood, so they take everything. So viral infection of the lung is much easier to treat than viral infection of the brain.
Right, so if it can
Lower
help
dose.
encephalitis, it can help this pneumonia.
Oh, for absolute sure.
Right. Okay, so what can people do? Like when you were in practice, what did you recommend they do with the powders and the doses? You know, you tell me about kids and what's their max doses and things like that.
Well, the dose that you should take is 100 milligrams per month of life till 10 months old.
100 or 1,000?
100 milligrams per month of life,
okay,
till you're 10 months old. And then you can take the 1,000 milligrams per year of life,
okay,
until you're 10 years old.
Okay.
And then more than 10,000 the rest of your life to stay healthy.
And that would be to bowel tolerance, right? So in these
Yeah.
times of stress, when their adrenals
Well, if
are
you're
really...
sick, you take it. Now, the reason I like the fine powder of vitamin C because it's just a pure chemical.
Yes.
Whereas a tablet is the pure chemical added to some filler bind or something to make it into a tablet.
Right.
So more than half the way that tablet is just junk you're taking to hold it together.
Right.
Or flavor. But anyway, the fine powder vitamin C is 4,000 milligrams in a level teaspoon.
Correct. Okay.
4,000 in a level teaspoon.
Yeah.
So you need 3 or 4 of those a day to prevent the virus,
Okay.
corona or any other virus.
And
Because
so...
it'll build your immune system so high you won't get in trouble.
So do you have any
No
advice? I'm meeting some resistance. Obviously, we have our group of doctors that we all know that use IV vitamin C. I'm having a hard time getting it into the hospital. What does the patient need to know to ask their doctor? Is this something they can ask at the hospital door? Is this something
Yeah,
they
you
can
insist,
request?
well, you give me this, or I'll go somewhere else. They're better off to come to a clinic that'll give them vitamin C in the vein than sit in the hospital and get ineffective treatment.
Well, that's true, but there's not a lot of that around. And the problem is, I just feel like if we could get more doctors to use it, we don't have to have people be sick for as long.
Well, I was fortunate that when I was at St. Charles General Hospital, we were on the board of the hospital. We signed the papers to borrow the money to build the hospital. So I had some influence there where the pharmacists would listen. And before I would work at St. Jude or Elmwood Hospital, I checked with the board and administrators
Right.
that they would allow me to give the high doses of 100,000 milligrams IV, or I wouldn't practice there.
Well, and your success rate obviously was pretty impactful to let them continue to do this and
Absolutely.
let you do it.
And myself, when I had cancer of the colon, they wanted to give me chemotherapy. And in that time, 1990, the chemo was no good for cancer of the colon. But they'd give it anyway, saying, well, that's all we have. You have to take it or die. I said no. So I took the vitamin C, 100,000 milligrams, more than 58 years. So
More than
I know
58
it's right.
years
Yeah,
you've
this
been
is
using
something
IV.
I have seen and done, not something I've heard or read.
Yeah. So when they say nothing can be done,
Well, yeah, that's a thing that doctors say. They would come, patients say, they were told nothing can be done. I said, that's just doctor talk for I don't know what to do. Doctors are so proud, they can't tell you, I don't know what to do, but go somewhere else, maybe they can help you.
well, let's hope and pray. I think we need
But
as
when
much...
anybody says nothing can be done, they try to say, I don't know what to do, but they're too proud to say that.
Well, maybe not always, but we do have something that we can
Guaranteed.
do. And I hope you guys continue to look at the posts and help me share this information. I'm going to be sharing some more of the papers and the studies that are coming out of China. I'm not sure what it's going to take other than everybody waking up to say, we want this. We want IV vitamin C. And I'm encouraging you all to take your oral vitamin C. It's not the only thing, but it's one of the main things that you can do to help improve your immune
Number one
system.
prevention,
Number
along with
one,
sunshine.
antiviral, and then go out in the sun and get your vitamin D. I hope you guys have an excellent Saturday, and we'll be back on for some more lessons soon.